I'm going to demonstrate to you now how I tape for a typical inversion injury of the ankle when you're getting a degree of edema around the lateral malleoli. So traditionally we would have used something like this high density foam that's sticky, don't know, Hyperfix, stuck it on, taped over the top. Instead of that now I'm using the Mobiderm. So I'm still probably cutting out a similar amount for a typical inversion injury. The Mobiderm I'm using here is the 5mm by 5mm. It comes in a big sheet and you literally just cut out the bits you need and put the sheet away. Any little extra little bits I tend to just keep, because if I need it for a small joint I've still got those pieces, they're still useful. The Mobiderm is a open cell foam, so it does compress, it's quite comfortable, and it's located within basically a Fixamol or a Hyperfix. So you've got the two layers, foam in between, and you can just sort of see it's fairly consistent pattern of the little cubes of Mobiderm. Before we place that on though, we do cover the skin with some foam underwrap. So like all taping, the bypass tape can be quite aggressive to the skin if left on. So I want to cover every ounce of skin I'm possibly going to touch. With it, it tears off quite nicely. So if you end up with extra, you can actually remove all the extra daggy bits after you finish your taping. So getting a good coverage and just coming down the foot a little bit extra just in case, making sure there's no holes. It just tears. I'll then hold the Mobiderm in place with the foam as well. So just wrap it on. I don't have to cover the whole Mobiderm, but if it's nice and secure, it doesn't tend to move when I'm trying to tape and I'm confident where it's sitting. So we're going to start with the 10cm biplast tape. So it comes in a nice big roll like this. There is instructions on the back of how to use it. I literally want to be able to cover over the Mobiderm and probably around the ankle, leaving about a centimetre or so left on the inside, so you're not tourniqueting the whole ankle. So with the first piece, I'll probably measure virtually top to bottom. As this is a new roll, I'm just going to get rid of that end little daggy bit first. So from there to there. With the second piece, I'm going to go from behind to about on top. Saying that, I want to actually tape the bottom one first. So you tear the top, break it down, turn back your little handle, turn back a second handle. You want two handles so you can hold the tape and stretch it. You can probably see the lovely chevron pattern on here, which is what creates the nice compression. So, pulling the tape around and just wrapping that handle around. Okay, and I've got about a 2 finger gap on the inside at the top there. With the second piece, same thing. Tear the top, just pull on it, that's what tears it down. Form one handle, get that backing paper off, form your second handle. Now with practice, you certainly get a lot quicker at this. Again, lots of tension on it. Place it over the top. First handle down and around. Second handle and around. and just making sure I've still got that 1 centimetre gap. If you've gone a bit too far, you can just trim your tape. From here, we're going to be using the 3 centimetre Biplast tape to almost like anchor or picture frame it. It's not anchoring in the traditional sense of we do with sports tape. It's more trying to enclose that edema to where we want it. So what I tend to do with this is, okay, there's my Mobiderm. I want to come down the front here. So I measure about the length of the Mobiderm. So I'll cut 2 lengths off of that. To start with, break the top open, start peeling back the backing paper. There's my Mobiderm there, so place it, pull down. Now the one thing Biplast tape does that sports tape doesn't, is you can go around corners. So I'm getting to the bottom of my Mobiderm in here, so I can place my finger there, go around the corner quite nicely, and you can see there's no creases. Again, break off the top. There's my Mobiderm at the back, so there. Place that on the top there. Start peeling back that backing paper. Get my handle down the bottom there. So pulling down, following it down. There's where my Mobiderm is. I want to go around the corner there. And on. So you can do 2 lots of this, and if you're going to do that, you'd probably overlap by 50%. From there, if you feel the need to do an anchor at the top, you can, but to be frank, I haven't felt the need to do so. From this point, I normally go with my normal taping over the top. So I put on my heel locks first, my 6s, my stirrups, and anchor off.